Here.
Judy Buchanan,
Here.
Hannah Eisner,
Here.
Corey Tello,
Here.
and Carla Pohl.
Here.
So welcome back to the committee, everybody. We've been apart for a while. And this is sort of the beginning of the season of looking at requesting and reviewing grant proposals. So the agenda that was put together was more or less to look at what's happened in the past year and then, in 2020, whether we can get a sense of how we're doing with our grantees in 2021 and reviewing the process and timeline, and then getting a report from Corey on Mental Health Advisory Board and what they would see us doing. And then we have one action item, which is the agenda. And I think if it's all right, I would suggest that we move that item up and go ahead and take action on that, because I assume our discussions will be pretty interesting on the other. So yes, Judy.
So move that we approve the December 20th minutes.
Okay, I'm sorry. And do we have a second?
Second.
Any discussion or corrections? None. So hearing none, do I vote for approval? I guess we have to do we roll call for minutes as well? Okay, so Amy, can you give us a roll call for that?
Sure, and I just want to clarify the December 2nd minutes, but I think it's still good. Susan Schaefer,
Yes.
Judy Buchanan,
Yes.
Hannah Eisner,
Yes.
Corey Tello,
Yes.
and Carla Pohl.
Yes.
The first item on the agenda is we basically had this report in our Board of Health packet. And if you recall, Bob Colhase had asked a specific question about how agencies are managing when there is a deficit. But I also thought it'd be a good chance for us to go through it. Amy, you could go through it with us and then explain a little bit more about that financial information you provided. I was myself not clear on reflecting our grant as an expense and how you came up with those numbers. And then I think you had asked the board whether there were any suggestions or recommendations for the type of information they'd like to include. So why don't you go ahead and you're muted. Amy, you're muted.
I think I'd be better at that by now. So as far as the financial piece, so I'm looking, I think it's like page 26, where it is just providing the information that Bob Colhase requested. So for example, where it has the financial annual report, this is something that has historically been provided by the agency since I stepped into this position. And I think it was maybe last year. So I think this is the second year of just sharing this information. So how it's reported is broken down into revenue and expenses, just specific to specific to the program as funded or partially funded by the Board of Health. And so for revenue, the MCHD grant, that is how much money that they received, which is usually the full funding allocation. But for 2020, there were many things that were not normal. And so for 2020, a lot of there was quite a few programs that did not use the full amount of money that was allocated. So where it says MCHD grant, that's the amount of money that they received. And then if you look under expenses and it shows MCHD grant, that's the amount of money that they allocated. So those two numbers should match. As far as like, this is how much they received, and then them also through their monthly financial reports showing that they expended that amount of money. And then back to the revenue where it talks about fee for service. That is how much money that the agencies received in any type of fee for service, whether it was, through private, public insurance, Medicaid, just payment, whatever. And so then that comes up with the total amount of revenue. And there were some programs that had other revenue besides just those two areas. But that's a quick explanation of revenue. And then as far as the expenses, where it says non-MCHD expenses, those are expenditures that they had to account for that were not, that did not utilize MCHD funding. And then you have your total revenue again. So the total revenue for the program as specific to what the Board of Health is looking at. And then their expenses is the total expenses again per that program. So for example, right now I'm looking at Chestnut Health Systems, their school program on page 26, and then their program deficit. So most of them had somewhat deficit within the program where their expenses were higher than their revenue. And then the percentage of Board of Health program funding, that is to show how much the percentage that the Board of Health is helping fund that program. So for example, if I went to the McLean County Center for Human Services, their Olympia School District, the Board of Health funding provided 29.9%, 29.96% of the funding needed for that program. And then the money, Bob Koolhaas asked, if there was a deficit, how do they cover that deficit? And so then I provided that answer throughout those last sections. So if there's any questions or feedback or anything as far as that part, and also Hannah and I did talk about it briefly. Reports are very time consuming, and I know they're time consuming for you guys as well because they're long and there's a lot to read. And so it's just really helpful for me to know exactly what you guys want to see as a board, and I will make sure you see that and you don't see what you don't want to see.
Corey.
I just had a question on pretty much all the agencies under the point of money or how they're going to cover deficits. It's pretty much their reserves, except for Project Oz said agency savings. What can you tell us what the distinction, what they mean by savings versus reserve?
I'm assuming it's the same thing. It's just agency language. Okay. So I didn't follow up on Lisa with that, but I'm assuming just like with the other agencies where they have the reserves is usually sitting in their savings. Right. So I think it's just agency language.
Okay, just thank you. One other clear point. So when you're saying, okay, percentage of Board of Health program funding, again, that is the percentage that our $553, or unless we took it out of our reserves, is paying for just that program within the agency. It is not there. It's not the total funding of the agency. It is just
everything. Yeah, and just to clarify on that, when I do the reports, when I do site visits and have discussions with all of the agencies, we it's specific to what the Board of Health is funding, or even the 377 board is always specific to that. So then that way you can see what your money is purchasing or covering, because the agencies have so many other programs also, and some of those programs probably don't even fit into the Board of Health. So it's always specific to the program.
Susan.
Yeah, one of the challenges that I have is the program deficit and the money to cover the deficit on that. I mean, to me, we are funding something that they asked for, and whether they have a deficit in that program or not really isn't totally relevant to us in that. And so those two numbers, or the program deficit and the money to cover deficit, where it comes from, I don't care in a way, because it's not money that we're concerned about. And so I don't really care if we see those or not, because, and it's just that program. And if you look at all these agencies, they have multiple different programs in their agencies that can cover deficits, whether it's reserves or they call it reserves or whatever. But I like the percentage of the Board of Health program funding, that percentage. I like seeing that number, but the actual program deficit, I think, can be misleading and not necessarily totally relevant to what we're doing. I mean, I can see some relevance to it, but some not relevance to it.
I think there's an implication there and that they should be separated. Mhm.
Yeah, and I think I agree with you, Susan. The other point that I would say is that they prepare proposals for us with a budget, and they're contracting to perform a certain amount of service with the dollars we give them. To sort of put that deficit in there suggests that somehow they're being shortchanged, and what they've submitted. I mean, if we've had to go and say, "Can you take less?" they've agreed to. So as you said, they make up the difference. In some way, they know going in that they may not be getting a total support from the Board of Health. And I think putting it out there begins to suggest that somehow we have some responsibility for covering that gap.
Mhm.
And did you, just to clarify, the expenses are actual expenses that you're pulling from some report? Where is that number coming from?
Yeah, and just to quickly back out, as far as like the deficit, if you guys are in agreement of me taking out that amount for deficit, I will do that. And just to clarify on that, I think the reason why that was kind of historically provided was to just kind of show the overall health of that, all financial health of that program, or where they may be having a deficit. But I understand how that could be implied in other ways besides just the financial health of a program. So so on their monthly expenditure sheet that they provide us, as part of their monthly financial report, those numbers on there are specific to their expenditures. So every funding line allocation that they utilize. So for example, personnel, benefits, travel, supplies, they provide that to us every month. And then for the past 2 years, the finance department and I have worked together we pick a month or 2 months, and then we have them provide us documentation showing us exactly how they came up with those expenditures. So like pay stubs, time specific to the program, invoices, receipts. And so those are true expenditures to the program.
Anybody else? Anything else about the reports themselves beyond that? I think what we're saying is that are we kind of agreeing that we don't need Amy to provide that type of financial information in her reports that shows the deficit? I mean, you're tracking the expenditures independently and so have that system for auditing, it sounds like. So if there's nothing out of the ordinary, I am comfortable that you and staff are watching what's happening. I don't know how others feel. And that
I agree on that because, yeah, we've contracted with them for X number of dollars, and to me, that's what we've contracted, and it's up to staff, Amy and staff, to verify that they are spending it correctly, and that when they get to their, whatever it is, if it's 20,000 or 100,000, whatever it is, when it gets to that number, then she will be letting us know that they've expended that money. But for the other expenses, the fee for service, the non, money that we're not contributing to, I don't think we need to see that.
Mm-hmm. Judy, I see you've got your hand up.
Yes, I really appreciate removing that program deficit line. I think the implication there is not what we would like. I'm interested in support of the summary report, and Amy, I think that adds a great deal to looking at this and putting it in a frame of reference. Is this summary report something that you yourself develop, or are you doing it? Is the agency providing it? Kind of share with me a little bit about that.
Sure. And I was hoping to be able to share my screen, but I don't have the rights to do that. So if IT is listening, if you can give me the rights to share my screen, I think that would help. to show what I'm talking about. Okay, thank you. I think I'm gonna share my screen, so that makes it a little bit easier to talk about. So you guys are absolutely correct. So we do keep an eye on to make sure that they're fitting within those budget expenditures each month. And then on the report for the quarter, I just want to have clarification. So on the report for like the quarter, do you guys still want, this is how much that they use each quarter in expenditures? So you guys still want that information, just not the line where it says this is the deficit. Is that correct?
Well, Amy, okay, sorry, I jumped in here. Are we not just paying a 12th of the grant each month?
Yes, so we pay them a 12th of the grant each month unless they're not utilizing the money, which was a first for 2020. So for this line where it says like financial report and it has the quarter one, quarter two, like these numbers are specific to the expenditures, not what they're receiving.
Mm-hmm. And that reflects then what they're receiving, or do they receive the 1/12 amount and then there's a surplus at the end that we recover?
So they receive the 1/12 a month. Yeah. And if there was a surplus, hopefully we would have just not given them the money. So we're not in a position to have to. But with these numbers where it talks about the financial report, yeah, this is not the amount that was received to them. This is the amount that they're saying on their financial reports. This is the amount of the budget that they have expended or spent within that quarter.
And within that quarter, they had already received the 1/12 amount. So what's the process for reconciling that at the end of a quarter or the end of a year?
So we would reconcile at the end of the year. So the process for that is we continue to monitor it throughout the year, and we monitor how much money that we have sent them and how much money they have expended. So if they're continue to expend their money at a rate of what we're paying them, then we just continue to pay them. But if we are at a point where it's June and we paid half of the grant allocation, and they have only expended 4 months, then we stop payment we delay the payment until they have expended that money. And this is in the contract, until they've expended that money, then to make sure that they're going to expend it and we don't get in a situation where we do overpay them, or at least get in a situation where we have to try to recover money from them. And then, but ultimately at the end of the year, they don't receive their last payment until we get their last financial report, so that we know that they've utilized all of the money, and then they would get the last of the money. So we do have practices in place to monitor the expenditures and make sure that we don't try to help with making sure we don't overpay them.
Thank you. In terms of that financial report, then that financial report line, showing the various quarters, really only reflects the dollars that have been committed to them or granted to them from the Board of Health. Is that correct?
Not necessarily. So for example, like on my screen, quarter one, January, February, March, they would have received 25%, but this is saying that they spent 19.73% of the 25% for that month or for that quarter. They received 25%, but they received 25% of the money, but they spent 19.73%. So as we're talking about this, I can see why it's pretty confusing, and maybe even this part doesn't really have value in sharing, and just more of us monitoring it.
Yeah, well, and I don't know about that, but I think your clarification just right now is helpful. And I'm wondering if that isn't something, if we continue to keep this, that we need to clarify how you come up with those figures. Because below, when we talk about the total cost of the program, the total expenses and revenue, But in this, we're reflecting only those dollars that we'd made available. So
Yes.
I don't have a problem with it being maintained, but I think some explanation would be helpful.
And Amy, a question I have then is some of these programs, like the crisis program, we contribute 383,000. The program budget is higher than that. I don't remember now what they spend in total. And we've struggled a bit with figuring out how we identify how our money is spent versus, and I guess we have personnel and whatever. So I assume most of what you're saying is person X is being paid a portion of that salary or fully out of the Board of Health money. Is that's what you're seeing is expense wise then?
Yes. And I think what would be, sorry, go ahead.
I said these are harder to pick apart than those in which kind of are standalone programs that we're funding like at 100% like the Project Oz.
Oh, absolutely. Yeah, when there's blended funding, that is definitely can be a challenge of picking that apart. But I think what I'm hearing you guys say too is it would probably be helpful between now and the next meeting to share with you what the financial report, the monthly financial report looks like, the template, so you can see how we track, how they track their expenditures, so like you can see what we're seeing and how we come up with these, how we figure out these numbers.
And that, that's additional reports and for us to review. But I think that that financial report, that 3-line insertion there, could reflect that what was spent of the amount allocated to them for that quarter. I think that would be helpful.
Yes.
Okay. And then I had also asked
That is what
about
that is.
the summary report, which you include at the bottom of the page.
Sure.
Is that something that you are authoring based upon your conversations and the information they give you, or who's prepared that summary?
Okay, so as far as that, it's kind of a hybrid. So the reports are due the last of the month, the following month, and then the month after that, I have quarterly site visits. And so what I do is I pull highlights from the report, and then we talk about what's going on, the overall health of the program, those highlights, and then of course, like there's conversation and feedback from that. And so the summary report, I write the summary report, but I pull that information from the reports and from our conversation. So that's information from the reports and the site visit.
Yeah, I appreciate those summary reports. Thank you. I think they definitely.
Yeah, and if we go down, look at the, actually go to the crisis page, the one on page 6 for crisis, just because it's easier to really kind of do that. So if you see on the financial reports, it shows like quarter 1 shows 19.73% and then 26.39%. But then if you go down to the statistics and you're talking about how many clients they're seeing, and we have the same issue, and actually we have the issue on all of them, I think. But when you look at how much being percentage, and there's obviously no correlation here between the percentage that they are spending versus how many clients they're seeing, because that first number is carryover from the previous year, which I know we've had these discussions in the past, how this is confusing with this carryover.
We don't do the carryover anymore.
Pardon?
I'm sorry, we don't do the carryover anymore. These are only for the year.
Okay.
The number is the first quarter where they count
Okay,
everyone that they see as new. It's no carryover. Well,
okay. So there can't be, maybe there can be correlation, but people might want to try to correlate the numbers on how much they've spent with how many people are especially the unduplicated numbers. Because if they spent less in the first quarter than they did in the second quarter, but they served way more people, that people are going to say, well, what's going on here? And that's where I think that it could be misleading or confusing as to trying to see if there's a correlation between how much things cost and how many people are being served. And the same
Right.
thing if you look at psychiatry is the same way, that if they spend, 100 and in the second quarter, they spent 122,000 on 10 new clients. Basically, that's what you're probably making that assumption, which is a lot of money.
So as
That's
far as we don't pay for how many, the Board of Health doesn't have the contract, like they pay a certain amount per person that they see. So sometimes you might be able to say like, on average, this is how much it is. But the way that the budgets are set up is with paying for staff, paying for, and sometimes like equipment, there's other things, but for the Board of Health, a lot of the money comes to staff. So like you're going to have those staff, you're paying for those staff that time to the program. And sometimes they may have more clients in one quarter than a different quarter. So it's if you're trying to look at like, what is the cost per person? I don't think that you're going to be able to come up with that. And one person might've been 5 minutes and one person might've been 5 hours, or so that, there really isn't a correlation between the output, the number of people served, and how much is being expended.
And I think so somehow we should, when we create these reports and give them to the Board of Health, that we should maybe make some kind of disclaimer that there is no correlation between there, because even the public, if they're looking at these reports, they may try to make that correlation, even though that it doesn't exist. I guess that was my point there, is that
Sure.
we need to make sure that what we're showing is clear as to what we are showing.
And is it helpful for you guys to see the output, to see the number of clients served?
Oh, yes.
Okay.
Yeah.
Absolutely.
I can put a disclaimer on there that there's no correlation between the amount expended in program and amount of clients served.
And let me follow up a little bit on what Susan said. And I know we talk about this unduplicated, duplicated. So Amy, if what you said is the case with crisis, is that we start with a clean slate. And so, and for the first quarter 2020, all these 460 people are brand new.
Well, it's not that they're brand new, but they were seen in that first quarter.
Right, but they weren't seen in previous years.
They may have been seen in previous years, but it's not, because the way with like the contract being new, like every year, the numbers start fresh each year. So those 460 may have been seen in a previous year.
Well,
Previous years.
Let's take the psych program, for example. When the first quarter says whatever 600 and is unduplicated, those folks, those 669 people, I'm assuming because of what they said, they have an ongoing service with people in terms of getting new people on, were their existing clients at that, so in the first quarter, they're saying they didn't get any duplicated, but in fact, I bet 669 of those are duplicated people. They were already being served by the center.
So, right. So with the 669, we don't know how many of those were served.
I think we need
are new, but do you guys want, so for quarter one, do you want duplicated numbers? Sorry.
I think one of the issues would be at quarter four from the year before, we would know how many clients they ended the year with. And so we should, but Amy, you might want to make sure that you clarify. So of how they ended the year, how many of those did begin with them under the new fiscal year? So we would be able to have those numbers, because we always would have the fourth quarter numbers for the previous year, and we could compare that with the first quarter numbers of the new fiscal year. So we probably should do that to see, how is, my guess would be many of the first quarter would be carryovers from the year before,
Right.
particularly in adult psychiatry, because these are chronic people that need ongoing care.
And that's fine. We just need to be clear, I think, and I'm not yet, that
Yeah.
first number, the first quarter number is not completely, I mean, if I understand unduplicated as somebody who's not been served before. And that as, or is
Within
not,
that contract
During that
year.
fiscal year, only during that, the definition would be not served before in that particular fiscal year. So every single year, everybody would appear as if they'd never been served before, even though they may have been on the caseload for 10 years.
right. And I
Amy,
think,
I wonder, right underneath the statistical report, the boxes there indicates the number of patients reported are from from health department and other funding sources. So are we saying that 689 were how many people were served in that year, totally, not just
Yes.
with health department funds? Because I think
Yes.
that, we're trying to look at under financial report, what percentage of the money we provide for them
Mhm.
is being spent. And these figures represent not just the part of the program that we fund, but the entire program. And I don't know if that's real clear to people, because that's sort of small print there. And, our funds are not paying for 689 people. Is that correct?
No, that is correct.
Mm-hmm.
except that we could be that, because if basically our money is to provide to ensure that the program is operating, we don't tie
But-
those particular clients. We make it a program that can be serving the community.
And I understand that, because we're not paying per person, and I think that's the distinction we should continue to make, that we're paying for a service, but that the 689 represents the number of clients that they served with all revenue sources, basically, is what it is.
Actually, in the applications they make every year, Amy, don't they pretty specifically say how many people they plan to serve just with our dollars? I mean,
Yes.
they do separate the numbers out by how much,
Well,
how many, to some
We're not
degree.
separating it out here. We've got apples and oranges.
Correct, that's what I'm saying, but in their application, they usually make it very clear what number of people they plan to serve just with our dollars versus other dollars. And I will say, this is the one program that we have asked them and gotten an answer how much they assume is the cost per person for this program, and it's $1,850 per person. And that's been consistent over at least the last 2 years, because I've asked if it changed, and they said that cost remained the same.
So if I can just sort of move us along, being courteous on time, because we could, with this one program or whatever, it sounds like what we're saying is this financial data doesn't match with the statistics very well. I would be happy to see none of the financial data appear on these reports. I think that's your job, Amy, you and your staff, to monitor that. Unless there's a flag out there that you think we should know about. But if it's business as usual, and on the statistics, I would like to see a way of, to me, that's a fiction to say, well, they're unduplicated under this contract year when we fund programs year to year to year to year. So I would like to see a way of changing that. Either those are duplicated, some are duplicated in that they were served the prior year, and some came in that quarter as new clients. But I think that gives us a better picture of how our money's being used and how it's benefiting. And, that, I don't know how others feel about that, but I have trouble with this just being a kind of a starting number of unduplicated as if the last year didn't happen.
Sure, and I think that's an easy fix. And so I think someone was talking about this earlier. I think Corey was like, the unduplicated numbers, with it being in the row like that, we know exactly at the end of the year, like, this is how many were served. But I think it's an easy fix with quarter one with all of the programs. If we still say, like, this is the number of people that were served in this quarter, new people served in this quarter, But then we still know how many people are in the, like, this is how many were served in the quarter, but this is how many were new in this first quarter. And then moving that way somehow, would still know the total number of clients served, but then you guys would also be able to see how many were new for that year.
Yes, definitely. I because we do want to know how many they started the year with. We
Right.
definitely want that number. And so some of those, of course, are going to be carried over from the year before. But then we also want to know each quarter how many brand new, never before seen in that program were added. So yes.
Okay.
Yeah, and we've had enough years with some of these programs that at the end of the year, when this is what you were calling your annual report, Amy? And
Yes.
so and this is something I've asked for many years, to see historical data that we have for these programs. Like we have, from 2 years ago, we know how many people were served by this program or that program. And so that way we can have historical data to see if these programs are possibly growing, are they shrinking, are they just maintaining flat, that kind of thing. And so I think that might be helpful to have some historical data, because, how many people did we serve, 3 years ago in crisis? How many people did we serve 3 years ago in psychiatry? And I know we have these numbers from that, even though we're doing this on an annual basis, we do have that historical data. And
Sure.
I don't know how hard that would be for you to create that in a report, because it just
I
plugs
think
some
that would
numbers
be
in.
easy. Yeah, I think it would be easy. If you're wanting historical data on statistics for the programs that have been in place for a while, if we look, some of them, I don't know if we would be able to look back as far as 3 years, because there were times where they were including everyone that they were seeing and not just what the Board of Health was paying. But if it's comparing the numbers, yeah, I don't think that at this point, like having some historical data, because they should have been reporting the same thing for at least the past few years. But so no, that won't be a problem to do for the Q1 report for 21. And then as far as like the objectives and goals and putting whether or not they met those objectives and goals in the report, is that helpful to you guys to
Very
see?
much so, very much so,
Very
because
much.
those are the things we always, all of a sudden, when we're starting to make decisions, we start wanting that information, and we should be paying attention to that every quarter, because
Okay.
if they're not meeting their deliverables, that is something that should red flag us and should be dealt with at the moment it happens, not waiting till we're thinking about funding again.
Right. And in fact, if I could, and this is related comment, but not necessarily to the pages we're looking at. I think it's incumbent on us as a Board of Health to really decide before we start requesting the information and have made the grants, what it is we want to see. Because historically, the last several years, we have taken issue with the information we received and set ourselves up for this jockeying back and forth, which I think does not serve the conversation well, and I think maybe creates the impression that we're not sure what it is we're looking for. So this is a really healthy discussion, and I hope that we incorporate it into how we line up our contracts and what it is we're asking for, and allow us then to feel comfortable making decisions based upon the information provided, rather than funding a number of agencies and then calling a halt to one or two that we think we need more information from that we didn't ask for in the beginning. And I just don't think that serves us well and our image being fiduciary responsibility for these tax dollars.
Do I see
Yeah.
somebody's hand?
That was me.
And then
Okay. Yeah, I kind of agree on these goals and objectives, is that we need to tell them what we want to see. And in a way, as Corey, are you going to say something about that?
I'm just going to say we do every year. Amy spends endless amounts of times parsing, and then she and I have talked to parse out what are the actual deliverables and goals that we want them to meet. But then last year, if you remember, some of you said, it's a weird year. We want them to tell us what they feel like they need to be aware of what's on the ground right now, because it's been such kind of an extreme situation, and you wanted them to have more weigh in on it. So we have collected. I think what I get frustrated about, this is in the reports. It's been in the reports for years, but I'm not sure people have read it. And this time Amy separated it out into its own section. Before, it's always been kind of all together. So I think what I get frustrated when we say, well, they didn't give us information, because it's the very same kinds of goals have been in these reports for years. I would be happy to show them to you.
No. I'm not saying that. I'm saying I'm looking at it from a different way. When you have, and I'm just looking on one of the, I'll look at a different one. If you look on page 15, when it said, and we're just going to use Oakdale and Kingsley, okay? And so it said, you're right, it's a weird year. But if you go down, 70% of the individuals, on objective 2, goal 2, it says 70% of the individuals maintain or make progress, blah, 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 blah. And it says 88%, 72%, 64%. Okay, so, I mean, I don't have any problem with the numbers that they're giving there. And because there's a goal of 70-some%. But are there numbers? Are these kids, because these are kids, are they making progress? Have they actually gotten out of the program? That's what I'm looking for on some of this stuff too. And maybe not, we're telling them that you have to have 10 kids that have to get out of the program, but maybe give us more details on what those numbers really mean.
And can I interject here before we lose our time? And I don't know, Paula, Carla, I see your green light on. Did you want to say something? What I was going to say, some starts to enter into our next topic, which is process. So, and that would go to the form of our applications and whether we want some greater, the outcomes are usually provided by the applicants, and those goals.
Actually, we do. Actually, we help set the outcomes in the forms that in the application form, we set it, at least right. Until this past year. You all kind of said you wanted them to do it more, but in the past we have set them very clearly. We have spent a lot of time setting them.
Hang on a second so that we can keep moving forward. And, I know that in the applications, an RFP, and then within the applications, there were outcomes that they defined. And so I think the report reflects those that came from the application. So, so if we feel like now that there were some numbers or details or whatever, or maybe it's percentages aren't as useful. If it's 2 kids, 88% looks great. Maybe we'll want raw numbers and those things. But before we leave this, are we done with kind of the report? It sounds like 2 things. One, maybe we don't need that financial data in the report itself unless there's a problem that Amy wants to bring to our attention. And that with the statistics, we'd like to have something that says, what was your caseload at the beginning of the grant year? Whether that's called unduplicated or whatever, but it acknowledges that there are existing clients. And then for the quarters, how many of these continue to be served? How many new people were you able to serve, et cetera? Does that sound more like what we were hoping to see? Mm-hmm. And then we'll go on with the next topic, which is process, and pick up with what you were talking about, Corey.
Hannah, my only concern with taking out the financial information is that we've had board members specifically ask for that information.
Yeah, and I tend to agree. Go ahead, Carla.
And she prepared this report. I'm having trouble with my audio. That's why my camera's not on. She had Amy prepared this report in response to specific questions by other board members. And so I guess I'd have difficulty saying, well, we agree this, but the rest of you Board of Health members, it doesn't make any difference what you want.
Well, I think that in the
Maybe it
interest
just
of
takes out the deficit line so that it does not look like we're funding the whole program. But for me, and we've asked this question, are these agencies getting additional funding? And when they show the additional funding and they're under income, that should be a positive thing for us, that they're looking, that's a sustainability issue.
And we know that from their budgets that they submit when they apply.
Right, but the rest of the board doesn't see that. They see it maybe once at the beginning. Really?
Now, Carla, is it possible that because I'm not sure I was supportive of excluding the financial report as much as I supported that we clarify what those numbers mean, that it's not, that it's the percentage of the grant that was expended, not of the whole program. With some clarification, do you think the financial report is in fact valid?
I do, because we ask for it later. I mean, this is, I'm sorry. I'm sorry I'm being a little bit obnoxious, but I feel like every year we bounce back and forth. We say, one time we say we want this, and then the next year we say, no, we don't want it. And then the next year we say, why don't we have that? And so I just think we're better to have a more comprehensive report, obviously getting rid of things that could be misleading to the public. But I think the more comprehensive we have and keep it over time, so we really can do those longitudinal comparisons, I think we would be wise to do that. And if we want to parse something out because of something that happens along the year, it's really better to have it than to all of a sudden say to Amy, oh my gosh, Amy, we got to have this information, find it for us. I think it's better for us to pay attention to it all year long.
And this is not saying we do not get the information. What I was referring to is the report that is compiled on a monthly or quarterly basis. And I guess, I just think the things that we brought up this meeting are important, and that data means something. And when it comes out and people don't understand the basis for it or whatever, it looks, we need to make sure that it's clearly stating and giving a good picture. And Carla, is there a concern from the other board members that these agencies are not using the monies properly, or they're not? What is the concern that you're hearing from the other board members?
I think that we as a group have raised questions throughout, ever since I've been on the board, about how some agencies do a good job spending the money, other agencies don't. We've kind of demanded that they look for other funding. So, I mean, that makes sense to me. You always want other agencies to have the funding. And so the other board members are saying, so we get the quarterly reports, because I think it's difficult for most people to look at the end of the year, but the summaries that Amy is providing actually give the amount of information that other board members want to see. And I can see where to me, it wasn't that difficult to look at the report and understand that budget deficit line wasn't our responsibility. But I could see if you just take out the budget deficit part, leave the revenues, I guess leave the expenses. That I struggled with having our stuff put under expenses, but I'm not an accountant, but I get it. So maybe Amy going to have to explain that in the beginning when she first shows the report. And then a line saying that this is not a fee for service program. I think most people understand that phrase, and that we are paying for positions and not for the number of people served, which for me is a real change from what programs that I've been in the past, where I've been the accounting person, that we're paying for positions. So the numbers served are not going to correlate with the amount of money that they used in a quarter. I think that's like a footnote or something at the bottom would be all she has to put. And I think that would clarify for most board members and remind those of us who don't remember that, I'm talking about myself, that this isn't a fee-for-service program. We are not, we do not fund fee-for-service services. Okay, I don't make any sense, so I'll stop talking.
No, you made perfect sense. That's exactly right. And I think most people don't understand that, Carla. So I think your point was well taken.
Right. And also, again, I go back to the fact that financial report columns reflect money spent on services for what we have granted them. The statistical report includes all the clients that they have served. And if we're going to keep both of those in here, I really request that we have clarification as to the difference in those two. Because
And that
we're
might
not-
be hard.
we're
That
not
might
the
be hard for
only
agencies to separate out.
I'm sorry?
From an agency standpoint, and I'm not defending any agencies, trust me, that might be difficult for them to figure out unless they say, we're going to 500 in adult psychiatry, you're going to serve 550 people. We start the year out with in a caseload of 500 that we're carrying over because they're chronic patients, and then however many new people, and your funding is 25% of our total. Boy, that's gonna be a struggle because we're not fee for service.
Well, no, and I'm sorry, maybe I didn't make my point clear, Carla, because the financial report columns indicate the percentage of the dollars that we granted them, they spent in that quarter. When you look at the statistical report, it speaks to the number of clients. And I think we're not the only ones looking at this report, and it should be clear that, as you said, it's not a fee for service. The number of clients just gives us a sense of what our piece is paying for.
Can I interject something here? When people apply, they provide us a budget, and in that budget sheet, they show McLean County Health Department dollars and they show other revenue.
Right.
And they also provide an expense budget. If I recall correctly, also breaks it down that way.
Right.
So what expenses we will pay for and what expenses will be covered by other funds. So it's very clear on those budget sheets. And maybe the simplest thing, rather than trying to extrapolate, is to provide those, use the same lines and such with the budget sheet showing McLean County Health Department, other revenues for a quarter. And then you see it, and with the line items, it's something that I assume we're getting anyway. So just be some spreadsheet work to add those numbers up across a quarter, and then it shows you clearly what's being paid for by us, what's being paid for by others.
And are you suggesting, Hannah, that then be in the brackets where financial report, the amount that they, what the 3/12 would have been, the amount that 3/12 would have been in that quarter, what they spent, and then what the percentage of what they spent of those 3/12. Is that what you're intending?
Well, either that or just provide the budget sheets with the numbers.
But that's probably another document. I think that if we want.
I agree. The more that it's all in one place and it's all spelled out in one place, the better, because I think that's when people get confused when they're trying to crosswalk information across documents and places.
And then, again, where I think some explanations, just some minimal,
We need a key.
summary points could be
We
made.
need a key. We need a key that says that puts the definitions of what is meant by this, and this, and we could easily do that. I think a bit of a key.
And I'm gonna keep belaboring this point. We need to find ourselves asking for and expecting information that we will use to make a determination, and we don't sit in the public eye for 3 months kind of debating what more we need that we didn't get. I think that those would be exceptional times, and those times are going to arrive when something very unusual happens. But we have a history now for about 3 years of kind of stopping action to ask for information that was never asked for before, that now we think we need in our deliberation. And I'm encouraging us to avoid that.
Let me suggest that Amy, with this discussion, put together a template for a report and circulate it so we can look at it.
Yes.
I think it would be unfair to ask agencies to change now since they've almost have submitted their first quarter reports. So with a look to maybe, and I don't know, maybe what they submit doesn't change. I guess it doesn't. So
Right.
it'd be what shows up and what we look at. So, you know,
Well,
maybe-
and just to quickly clarify, I don't get quarterly revenues they receive from other services until the end of the year. But I just wanted to
Okay.
clarify that.
Well,
I would be happy to put together a template in the next couple weeks and send that over to you guys and see what you think.
yeah, so you get what? Revenue, you don't get a revenue report, you just get an expense report?
Yep.
Okay.
I only get the expense report monthly. And then the narrative and statistic report quarterly. And then as far as kind of like, so they have their budget, and then the yearly report is just to kind of show what actually happened with that budget, because the budget was proposed, and then especially with COVID changed greatly. So they do the budget at the beginning, and then kind of this is what actually happened at the end. These are the expenses and revenues at the end. They don't provide revenue throughout.
Okay. And hang on, both Judy and Corey and Carla are, I think, you know, we are at 10 o'clock. So our meeting is scheduled to go to 11. I'm happy to talk more about this, but I thought maybe the best way to move forward is to have Amy kind of take the talking points and put something together, which would make the financial data clearer to those, also the case numbers clearer.
Sure.
This has to do with what might be on that template. That's why I'm raising my hand. Okay, so in the past, Susan in particular, I don't mean to put you on the spot, Susan, but you have always, when we have been in some deliberations around funding, you have particularly asked for a couple of different documents that you want from certain agencies. And so I'm wondering how we can get out front of that. And again, I'm piggybacking on Judy's point. If we know those are documents that we're going to want, can we ask for them early on and get them so we're not holding things up to get that information? And I'm not suggesting it's not good things to get. It's just can we ask for it as timely a manner as possible.
and I guess for the committee to clarify why additional information, what it is we're looking for.
And I think this is somewhat of a process question, a report question. So
Bless you, Hannah, you keep trying to redirect us.
you guys are like herding cats, I'll tell you. So I guess what I'm saying is I think you're right, Corey. That goes to, I think, what are we requesting? And again, let me just jump in ahead myself. We have talked, and Samantha, good, you're still there, because we've talked about how do we deal with the fact that there are some agencies that we fund year to year to year to year, and yet we act like we're just starting the process all over again. So is there a way to have a renewal application? And with that, we might want more of that historical data, or we might want it from everybody that, they're audited. They should submit their audited financial statement for the most recent year. They should submit a copy of the 990, which are the two things that Susan's referred to, and make that as something that they attach to their application. Everybody. So it doesn't single out any of the organizations.
Yeah, I mean, because in fact, they are asking for a renewal. That to me just makes sense, and would probably make sense to those who are watching how we're spending their money.
Jump in, Samantha. Don't wait.
Are we all
You're
patient, Sam?
So there are other areas in the county that is that's what happens, kind of a renewal application. So if that's something you wanted to restructure, I'm sure we could look into that.
Very good. Very good. Thank you.
May I just point out that for this year, for example, every single one would have been a renewal application. So just wanted to make sure we're clear on that.
And that's something we have to, it's driven, whether it's renewal or new, it's driven by what we have gleaned from our advisory committee and others are the needs. So, I think we go back to that, whether they're renewal or new.
So before we move on,
Automatically renew.
are we done with the report discussion? And we want Amy to provide us a sample of a revised report that we can review and maybe look at next meeting.
Right. Yeah, Amy, you can
Or,
put yourself in a room now and
Okay.
well, the other thing you might want to think about doing is if we could put this on I don't know if you want to wait till after our group is done looking at it. It needs to go on the Board of Health agenda with the template. Because that's the only, if you're addressing the questions that board members have.
Yes.
Well, and Carla, I asked at the last meeting, we advised them of the meeting and said we would be happy to have any kind of questions raised, and I didn't hear from anybody. And, so I would ask you to share what those concerns are so that we can act. I mean, if, not trying to be obnoxious here, but, I think if the committee has been charged with some of these things, then let the board members who have concerns, please talk to us about it. And if there are some underlying issues we don't know about, we need to know. I would question whether the board has to approve the form of the report. I wasn't even anticipating this committee approving it.
No, I wasn't saying approve it. I was just saying that, folks, if you have board members look at it, if I have to send out emails and tell people to not just nod your head and smile, I'm all for that. I mean, I've been sending out weekly updates anyway. So if there's something else that they want on the reports, then they need to speak up. And that's not that I'm not going to call everybody. That I do not have time to be calling 10 board members.
or should you have? Mhm.
So I'll send out an email telling them that we're working on the financial stuff. And if they have questions, if there's specific items that they want on the financial reports that go in the packet, then they need to speak up and talk to Hannah and Amy. Okay,
I think
I'll do that.
that'd be
Good.
great.
Thanks, Carla.
Okay, so now we are at our next item, which was sort of a general description of process and timing. I'm going to say that timing, maybe, I know, Amy, you attached a timeline that maybe for today's meeting, since we're running long, as is usual, that we look at that and give her some feedback on that independently. I agree. I think, Amy, you raised the question of, it's not set in stone. I think it's aspirational. So, and we've certainly done that already. We thought we could get to a certain point by the date in that timeline, and we couldn't. So, so I'd suggest maybe giving her feedback on anything you think in terms of the timing, and let's talk a little bit more about process. And then we need to get to Corey's report on the Mental Health Advisory Board, which is
Sounds good.
so.
Sounds good.
Why don't we just open it up and talk about process? And I know, Judy, I think you had some thoughts on it that you had talked to me about earlier.
I think I've made my point relative to what we've done in the past. And it sounds like if we look at the information we're asking and are clear, that will eliminate that. I just didn't want us to be in the public eye again, kind of at the 11th hour, changing things. I also wanted to remind us that we as a board, and I think as a committee, have discussed recovery courts and where that fits in and the history of our funding, because obviously they're here, they're doing a good job, and they are needed. But there had been some confusion about the costs people want to know if there were savings. I don't know that they're saving actually money that was budgeted, and the impact. And now that we have other programs like Fuse, like Triage, is there any synergy in those in terms of what's happening with either the number of people, the cost, the impact? I would like to ask that we either hopefully would have someone from Recovery Court. I know they came to a board meeting, but they simply, I believe, just reported out some statistics, which were good, but we didn't have an opportunity to really go into much of a discussion. And this seems to come up in our mental health advisory board discussions, as well as on the Board of Health. And I'm not suggesting it is not a valid program. I just think that my sense is that we would like some more information, and perhaps be able to reduce the questions that are being surfaced. So that is one. And then another point is, I know Susan is getting ready in the process, actually, of taking a look at the mental health action plan and revising and reviewing it. And so I think we need to be mindful of that. And Susan, I'm not sure how what we're doing, what we're looking at, what we have done, how we're going to feed into that, because we have a group of pretty knowledgeable people on our advisory board right now looking at what are the needs, what are the real needs, and how are we going to loop that in to the deliberation so that the plan does reflect some of the needs that I think they're identifying and documenting for us. So those were a couple of things I wanted to ask about. And they're process questions.
So I guess what I would think is maybe today is more of a, let's get it out on the table, and then we'll start to hone in on things that might change what we do or not as we start the cycle again this year. So anybody else have some issues they'd like to raise? Corey.
I think that the pandemic has exacerbated everything, and it has also created an intense response and lots of different responses, which is a curse and a blessing. It's a blessing because so many people have stepped forward, so many agencies, so many coalitions, groups have come together to try to be of help, but it has also made it more complicated to be tracking who's doing what, who's working on specific deliverables, where is their intersection of those, how are we getting the synergy from groups that have kind of common mission and goals. And I think that's what, BHCC was created for. That's what the Mental Health Action Plan was created for. So I think Susan's, like Judy said, Susan's right in the middle of all this. But I feel like anything we think about in terms of mental health and substance use and just in general, the intersectionality now of so many other things, like we now know how much social determinants of health affect mental health. We now know how much people who don't feel safe, either because of housing or food scarcity or whatever, how much that affects mental health. So, and then we also know there are massive coalitions being formed. There's also dollars coming into this county from grants, from federal relief packages, from Recovery Act, from state things. Townships are doing things. And so I when I think about Susan's job, it's like daunting because I have become incredibly aware of how it has just blown up. But I also think part of our process has got to be, how are we working with other entities that maybe share common mission and vision and common deliverables even, and how do we bring that to our decision making so that we're not operating in a vacuum, and so that we are also maximizing the dollars, maximizing the outcome for agencies, also not making agencies dance to 500 different drummers. So that's my soapbox. So that's somehow I want to work that into the process.
Susan, sounds like you have something to tell us too.
I'll have a lot more when we get to the next item, but one of the things that I think may be a misconception or something on everybody in the community because of the demand now and because of the pandemic and what it's done to everyone is that, you know, if you look at what we just said, that these have been continuing grants for many years. It's not like there's all of a sudden this money that some of these, you know, groups or whatever think we can all of a sudden start spending it on, because we're already funding some of these things that are continuing, you know, like with the crisis and with adult psychiatry and the prevention, you know, for the kids and whatnot. So I think that there's a huge misconception on some of those things that we are able to even do in the first place with no money to be had. And yes, there is money coming in from other areas, but we also have to focus as we're the Board of Health. And yes, there's social determinants of health, and we should be considering that in when we're funding things as how that actually impacts it, and working with other people, other groups or coalitions that are working on those social determinants as a whole Board of Health, not just on the mental health part on it. So I think that that's what we need to focus on with some of the things that you were just saying, Corey.
Judy.
Yeah, I was just thinking, I don't know how many cats we can get in the room for you to herd, Susan, but that's going to be part of your job. Yeah, I think that as Corey related, our involvement in working on recent webinars to do outreach to different populations has made me keenly aware of the inequities and the disparities that have been there for a while. And I think as a Board of Health, overall health, we have a particular responsibility. And I know I'm talking to members of the board and others about how we draw that in and how we look at it across the board, not just a lot of it relates to behavioral health when you look at that whole person. But there is a much bigger issue, Susan, that is overlapped with behavioral health, or one or the other overlaps. And my hope is that we can look at at least post partially pandemic, some of that, because health equity is something that is part of why boards of health exist. And we hope that we can take a look at that and evaluate it and announce our strengths and our successes, and then make a plan for where we go from here. So anyway, just wanted to include that.
I have some thoughts. I didn't know if anybody else had some points to make at this point. And mine are a little more concrete. Kind of get to some discussion going on. I think all the points made thus far are absolutely, you know, on a policy level, what we need to be looking at. We always struggle. And last year we had to deal with the fact that we had applications for more money than we had to award. And we were looking at programs we made. And I know Amy shared with us a letter from Project Oz, where we had to make a tough decision that we thought that program could hopefully find funding elsewhere. So I guess my questions are kind of the following. As Judy pointed out, historically, we've basically just renewed existing programs. We've had occasionally been able to add new ones, but are we looking at a situation where we want to look at, okay, we're looking at applications for renewals, and for these programs, these are areas we need. And I don't know that we want to encourage applications from different programs. These are questions, not answers. So last year we came up with those 4 categories, and we said, okay, within these apply. We didn't give any dollar amounts. We just left it open. I think that's what you were referring to, Corey, and that in previous years we'd been more specific about we have X amount for different areas. So one, do we want to maintain that as opposed to going back to the other? And I agree with you, Corey. It's like this, that way, no, that way, and why didn't we know? So, I mean, there's some value in consistency here if we can reach it. are there programs that we look at now before we go into an application process that maybe we're saying they've gotten to a point where we can let somebody else take over? You know, I don't know how we make that decision. I know there's been some money that District 87 got for embedded schools. Are we looking at how we fund that one? These are,
Their grant is not necessarily for embedded schools. We need to be really careful. And that we also cannot use that grant money just to plant existing services.
yeah, okay. I'm just throwing
Go back to our focus. Okay.
And I guess one of the things is that, so let me see, I guess the question was that, so do we want to open it up like last year, just with the 4 categories? Are there programs that we might look at and say, everything needs funding, but you know, how do we do the most with the money we have? And rather than put people through a process of applying for something when we know in the end we can't do it. I don't know that that's the case. I like innovation. We've done it basically this same way for many, 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 many years. And the rough way we go about the process, but let's see, I'm looking at and then the other, and I think we need to ask this question is, this county now has 2 sources of funding for mental health programming. We have not, in my mind, done a very good job of combining at least discussions, talk, how we make these work together to serve greater needs. So I feel we're somewhat siloed within the county. And I think we need to also, that could be a process of, are there programs where money from both sources could be used to enhance or could create a new pilot program? So, and it's in a sense to start this process of weaving these together, which I think really, you know, we need to do that. We're catching up with ourselves. And I think maybe this year we can finally look at the programs that have been started, I think are up and running now. And I think Triage anyway has gotten some good press. I don't know how how many clients are there. And I guess I don't know. I know, Corey, you mentioned there's a new grant that isn't with the sales tax money for youth. Whether the telepsych program is something that's still being pursued. But anyway, I think we need to have a formalized way of discussing and making sure we're working together and not at cross purposes or independently. But
I wholeheartedly support that, Hannah. And I think as part of that discussion about what are the revenue sources and what they are funding, we need to be mindful and clarify of those revenue sources. Some of them are very specifically defined for the population or the service that they can provide, so that we separate that out and don't leave the expectation because someone got a grant for $500,000 that we think we could share it. It may be that's limited, and that happens quite often, particularly with some of these federal grants.
And the last point I was going to make is, and on the embedded schools, and I see you, Corey, was we talked last year about whether or not in making that grant, it should go to the education side, whether it be the ROE or the school districts to then distribute the funds to schools in need. Right now, we make them to kind of a blend, but they're driven, I think, by the providers. So I think if we want to look at that, we need to start working on that now. So we're prepared to know who could do that if they are interested in doing it that way. So those are my points. So yes, Corey, I think you had.
Well, I agree with what you were saying about, but I think what's really going to be, we have to, I think, be driven by what are the deliverables for some of these grants. I mean, speaking to Judy's point, I mean, you're right. When they get a grant, it's because they've agreed that they're going to deliver certain outcomes, and that's what the grant dollars should pay for. And so we can't assume that because we can't assume that we can change those deliverables or make them start paying for something that they've been getting from us that may have nothing to do with those deliverables. So we do have to be clear on that. So that point. And the other point about embedded schools, I think it makes very good sense to have a conversation with Regional Office of Education. But I think before we say this is the way to go, we really need to get their input. I mean, to hand this to them at a time when schools are in crisis in many ways, I think we just need to make sure that this is the right time to do that. And so I think, and again, they can help us figure out why we should go that way, what makes sense, and what's reasonable and what might not be reasonable at this point in time. So that would be my recommendation, is have a conversation.
Yeah.
Judy, then Susan.
Yeah, thanks. I wholeheartedly agree, and I also acknowledge that right now, for the next 12 to 18 months, we don't know how any of this is going to happen and move. But we could start that conversation, and maybe if they're receptive, we look at some kind of a phased-in opportunity, or maybe it's a collaborative opportunity that, as we've had with the county, for example, for recovery courts, we've collaborated, and that's a big piece of what we want to encourage. So I'm wholeheartedly behind, in the very near future, having that conversation with ROE. We've talked about it a couple of times. I don't know if they're aware we're talking about it, but I certainly would appreciate our having that chance to open up that conversation with them.
And I would just add that, with Chestnut's person resigning, so that pretty much took Chestnut
Health of
No,
the,
but my point is the only agency right now that's providing that service is Center for Human Services.
yes.
Yes, that's my point. So that's another interesting thing, is are we interested at all in trying to get other agencies to join that? Or is this something where that's going to be a partnership between districts and CHS, and we support that? Again, that's a process question. Do we want to have a role in trying to expand, enhance, or do we just say this is kind of how this evolved over time, since it began, and that's why we did a pilot project. We wanted to see how it would evolve, how people would learn and grow with it, how it would expand and start paying for itself, which it has done in many ways. When you think about, we initially paid a ton of money each year, and then we now got it down to $20,000 per entity. So again, but are we okay with right now it being pretty much one agency in the schools?
Susan, and then Carla, are you trying to get into the conversation? I can't see you, so.
Yes,
Okay, after Susan, okay.
I'll wait till after Susan.
One of the things I've said for years is I want to create a playbook for the schools to be able to hand them and say, this is what it takes, this is what you need. And I think that ROE would be the prime facilitator for that, to move that forward. And actually, with some of the money the schools are getting from the federal government right now, I believe, or they're going to be getting, because they talked about it, how many millions and millions of dollars they're going to get from that COVID package, the big stimulus package that just got passed not too long ago. Do we need this playbook now, or do they need to start working on this playbook? And like I said, I think ROE would be the prime facilitator for that. And because we have enough experience with this in the embedded schools. And then you also have District 87, which I've talked to Diane a little bit, and Corey, I know you talked to Diane Wolf about their planning grant. And it's not necessarily exactly the same, but that can be helpful because we are also funding some of their schools, right now. And to provide that feedback to ROE so that when schools start in the fall, they have something. And yes, right now we only have one agency that is providing services in the schools, but this is how you engage with that agency, and this is how you do this, and that kind of thing. And it's been shown by Chestnut that in Ridgeview is that they have never applied for any more funding for Ridgeview because it is a self-sustaining program, and that there are schools that are self-sustaining, so that actually it isn't going to cost the school district any money, even if they got money from a stimulus program. So I think that we really need to put that out, and I don't know who, I'm not sure if there's somebody, in this group that would write that kind of thing, but I think that if you work with ROE to do that and have that, so that this fall, especially when kids actually come back in person full time, which in a much more routine type of way, that they have something, and that even if they don't start something, they can go back and look at this and say, okay, I think we need this in the school, and also to work on the buy-in from some of the principals and some of the superintendents from some of those districts. And so we have to be looking forward enough on those too, that at least here, we've given you something, you can take it or leave it, but don't complain to us if you're not doing something and we've given you something, you haven't even looked at it, kind of thing. So I think that if we can give them information, and so then they can make their decisions based on that information, and whether or not there's funding that follows it might not, be the same. And also ROE has money too.
Just to piggyback on that real quick, she's talking about an implementation guide, and
Right. Excuse me, Carla was waiting and then you can go.
I would suggest that we get a hold of the folks from ROE and put them on the agenda for our next meeting, so that we can, and maybe prep them ahead of time that this is what we're going to be asking them, what they want to do, so that we're not discussing this in a vacuum. And the second thing would be, maybe come June, I would be willing to work with ROE to develop an implementation manual. It's something I've done in the past, and I'm retiring.
Oh, good for
You
you.
can't see me smiling, but 4 more weeks. I can hardly wait.
Oh, great. Well, Carla, I agree with you. I think we should have discussions with ROE. I think we maybe just want to get a couple people or a person or two, or whatever doesn't create a meeting, to first just maybe reach out to Mark Jontry. I wouldn't want to kind of blindside them in a meeting without having had that discussion first. So agree, and
Yeah,
congratulations.
definitely talk to them first.
Yeah. Corey, sorry.
yeah, I would just say, along with the implementation guide, we must have input from Center for Human Services. They have been doing it since the beginning of this pilot. They have learned a lot through the course of the pilot. So their input on what has made some schools be much more highly effective in terms of broad scale reach versus just going in and doing clinical services is going to be important. So again, that implementation guide really needs to have input from all of the players that have been deeply involved with this from the get-go. I think we can also learn from the failures. I mean, I think we can learn which ones have not done well. And in many cases, it was because a strong relationship was not established. And so, that all needs to be part of the implementation guide. So I would just say that needs to be a, multiple input.
Happy to reach out to Mark Jontry, to just kind of, as you said, they may say, oh, we couldn't possibly take another thing on our plate.
Right.
And we're talking about something that would happen in January of next year, right? So they would have plenty of time. I mean, this would be for our 2022 funding. And our schools are though off, aren't they? But anyway, I would be happy to reach out to him and just say, this is something we're considering. Is it even something you could handle? And I agree, Corey, and if they say yes, then I think the next step would certainly involve people who've been involved in delivering this type of service. And I don't know, Carla, if you were maybe after 4 weeks, and knowing that you would be happy to do the guide would be wonderful. So, but I
I
think
just want to also say there are several guides already out there, because this whole embedded school thing, this whole interest system working is well researched in the literature. And so there's also stuff that's already there that we could certainly start from, that would be a base to start from, that would have key concepts that we would want to include, as well as very concrete step by step.
So at this point, it sounds like there's some interest in seeing whether we could shift this to be a program that would have an agreement with ROE, some type of intergov, I would think, with ROE. It's sort of like what we do with the recovery courts. We're giving it to that umbrella organization who then can engage in identifying where the needs are, et cetera. So if that's the case, I'll be happy to reach out and either plan to, if Mark would be interested in coming to our meeting next month, or at least report back. Does that sound okay to everybody?
Yeah, and
Right.
Mark won't be blindsided by this either, because I've had conversations with him about it, and because he's on BHCC, I know that there's going to be some other discussions and stuff about that. Yeah, it's not going to be a surprise.
Okay. So in other areas, what do we want to do about the RFP? Do we want to say, sorry, folks, we know we didn't have enough money to fund new projects last year? Do we want to identify some money, set some aside for new projects? Do renewals only? Do the same thing we did with the categories and let people apply? It makes sense to me that some of those programs that we know we have to maintain in the community, and typically what we're looking at, like PATH, Crisis, CHS, are kind of the backbone, if you will.
Well, I think we've also said problem-solving courts too. I think we've said that's kind of a given. So the only thing that would be, and I think we've also said youth suicide, the whole suicide prevention piece are all ones that I'm sure that we feel like are core services. And then my other question, Hannah, what you brought up earlier, is if we are going to talk with other entities about any kind of county-wide funding pooling, would that change how we might look at this? Or are we still keeping two very distinctly different pots, that 553 is only going to touch what we've already touched? Or is there going to be any kind of a blending of other county funds where we could look at this more globally and maybe then change something? So
There's a lot of abilities with grants that might require matching funds that we could provide. I think there's a lot of things that we haven't examined. Yeah. Yes, Susan, and then Judy.
Susan? Oh, go ahead.
Because I'm trying to keep the other stuff, for not the process, but the mental health advisory board stuff separate. But they're also intertwined. What was I going to say? There is, and this is something that the finance people from the health department can look at, because there still is room in the levy to increase the levy a bit for the mental health. Nobody wants to raise taxes, so there could possibly be, and it would have to be something that, I think her name's Jackie, and Jessica would have to see if we can work on and there's ways to work around this to actually increase the Board of Health levy, but not really increase the overall county levy in different ways. So that might be an option, because we have, when you look at how much funding that we're, pretty much committed to between crisis and psych and ending the silence and stuff like that, the programs that we're already funding, the continuing funding, there really isn't any wiggle room. We even had to cut programs. We had to cut the Too Good for Drugs program. because we wanted to make sure we had some extra funding for psychiatry and whatever. And babyfold when they wanted the early intervention, because really, when you think about the health department, we're supposed to work on prevention. We're supposed to be at that front end as much as we can. And, but there's really not a lot of extra money to be had, which is what I said earlier about how people think that we're going to have this money to spend and we really don't. And so, and that's where maybe we have to start looking at that levy and how we can adjust that through the health department and that kind of thing. Because if we start taking just taking it out of reserves to fund some kind of new program, that eventually that's still not sustainable. So we have to kind of, when it comes to putting an RFP out, I'm not sure we're ready at this point to say we want to say anybody and open it up to any kind of thing, like we had to turn down, some good ideas this last time, so.
Judy.
Yes. Okay, Susan, I'll go with you to talk to the county board. No, just keep my mouth shut.
It's not the county board. It would be all within the health department.
I know.
Okay.
It's exciting to think about that. And I suspect we could build the case on any number of fronts for the fact that there are additional dollars that are needed in the area of behavioral health. But I was going to comment on the notion of renewal. And I think Sam said she was going to look at that. And I don't know whether there's some criteria or some rationale that we would have to take into account. But I would caution us to use that as one of those options out there, because that presumes renewal programs would be that there is no one else who either is thinking about or finding themselves in a position to provide a service. We can't assume that all the players out there are known to us. So I wouldn't want us to kind of put all of our eggs in the renewal basket.
Yeah, Corey.
I'm still wondering, this is a process issue. I'm still wondering too. We know that John M. Scott this year funded some services, some counseling services for kids. And we also know that United Way, set aside some money for the adult adolescent. I don't know if they set aside money, but they still on their website act like they're paying for or supporting an adolescent outpatient unit that never materialized. So I also think, do we, again, as a process, do we reach out to those two entities as funders and say, is there any way that any of what we might do might be blended? I mean, because if we've got three funding sources looking at youth programming services, should we be talking with them to, again, decide, is this more in your niche? Is this more in our niche? And so again, maximizing the services based on, being really well coordinated.
That I can speak to that adolescent outpatient. There wasn't the United Way was matching funds for the county, and and they're committed to that. They're still committed to that. It's through BHCC, but they have said that they are committed to us moving forward. That the RFP was put out last year, right as COVID hit, and nobody applied for it, and so it's still kind of there. And so there is the intent of going forward with some of that kind of stuff with that, even, and I'm not sure about what Scott Commission is actually doing on that. I know I talked to Holly and I can't even remember what she told me about it. So there is some things that they're still in the future. So there's, like I said, this process, and then there's the stuff, coming up that we're going to talk about.
Okay.
And let me just say one thing, and then I think we got to move on. But I agree completely with Corey and Susan. Yes, we could raise the levy. We could also look at, we have two funding streams right now, and the sales tax and the property tax seem to be never the two shall meet. And I guess I would advocate that we need to have conversations within the county to make sure we know what each program is doing and how, as we make decisions, we can enhance those programs across the board, across areas. I mean, I guess I'm a little concerned that we begin to silo, as I said. And yeah, so Corey, I think, maybe if you have so many connections in the community, it might be helpful for us to maybe have a meeting where we bring in United Way and Scott and Tricia and say, here we all are, we're local funders of mental health services. What are we each doing now? And do we see places of connection or not? And just make sure there's a conversation going on.
Thank you. I totally agree. And I think to me, it's all about the deliverables. I mean, what is it we want to buy? And collectively with all the funders, what more can we buy if we're smart about the way we're sharing the money or sharing the planning or whatever? I think we could just really maximize things and plus not confuse people.
Yeah. Yes, Susan.
We can move on now because then I can answer all your questions. Not answer your questions, but I can say a lot more because I don't want to mix up the things that we're talking about. So let's move on.
Okay, then we'll move on. So process-wise, I think the thing that we've reached today is we will reach out to ROE to look at maybe how we could shift how we grant funds for embedded schools. The other stuff is still kind of on the table. I think the timeline that Amy had set out was to come up with funding priorities in May. I just looked at it, now I can't remember. Your was a May 12th meeting. So we've got some time yet to discuss some of these other things. So yeah, so how about we go on to Mental Health Advisory Board? And I don't know where we want to begin since Susan's been waiting. Corey, do you mind if we let Susan go first and then, okay, hit it, Susan.
Okay, so this was, sounds like they spent a lot of time on this and had a lot of good things in there. One of the things that, as you know, that I am leading the update to the Mental Health Action Plan. And this is it's becoming a lot bigger than I thought it was going to be. But I have an outline that it actually covers quite a bit of the information or quite a bit of the topics and bullet points and in this document here that you have. Excuse me. And so I've already, met with Tricia a couple of times. Chairman McIntyre is going to have roundtables. I'm going to probably have some small groups. I think, Corey, I did mention that to you when we were talking before, for various topics, specific areas and stuff like that. Right now, where I'm at in the process, like I said, I have an outline. Chairman McIntyre has looked at it. And Tricia's looked at it, and we've gone over it. And, we're working on collecting data. Tricia's been getting some of the data for me, and I've reached out to some people for data to put in there. And we're working on exactly what I've done so far is I'm doing the stuff that I have, and then we're filling in where we're going to need the small groups and chairman roundtables and stuff like that, because some of them there are going to be some hard conversations in some of these groups, some very hard conversations, because it's been a long time. And you talk about siloed money, we're still siloed in our agencies. And I think that COVID has created and made everybody more siloed. We were moving in one really good direction to break some of those silos down and work, much more collaboratively. And then COVID hit, and I think that because not just funding, but just everybody's attitude, everybody just pulled back. And so we have to get back to that, moving forward again on some of those things. And so with the mental health action plan too, is that there's some short-term needs, obviously, but that mental health action plan update is going to have some more long-term needs. The first time, if you look at the first mental health action plan, it was pretty broad. All those categories were very, very broad, increased collaboration, cooperation. Crisis was, hey, we're doing okay, but look at what we've added in. There's still gaps in there, and we know that. And so, and then with housing, we've done some things and moved forward on that and gotten vouchers and using Fuse. But now with this, the update is we have data. We can look at historically what we've done and what has happened over the last 5 years since we actually had that plan, and say, okay, so now where are the gaps that we need to really address? And then the pandemic showed us, not necessarily that there were things we overlooked, but where some more specific gaps are when you look at like social determinants of health and things like that, and disparities there, where that original mental health action plan never went into that kind of depth. And this, now that we have data, we can actually go into that depth in the update. And so it's going to be a short-term and long-term. There's going to be short-term things that can be done and long-term things that can be done. So it's going to be pretty involved, and but I think that I've kind of got a good plan, and have reached out to people. I need my vacation before I really hit it harder than I have been. For a while there, I was spending time working on getting vaccines from McLean County. So it's like, okay, mental health action plan can wait. I'd rather have everybody vaccinated first. So I guess that's where I'm at. And I think that might answer some questions, or not necessarily have a really long discussion here about that, unless somebody has anything specific. So I think that mental health action plan update will address a lot of what are the things that the Mental Health Advisory Board has in there, and that some of their concerns and stuff like that. And I can use some of their expertise when I actually get to certain sections on that, because I have to make sure I do this methodically and things like that. So is that helpful for everybody?
Yeah, I do have a question, Susan. So you mentioned different people involved. Are there health department folks who are sitting on this thing, and Carla or whatever? And maybe it would be nice for a report at our next board of health meeting.
It's coming out of BHCC. So I'm going to, when it comes to small groups and things like that, I am going to ask people that I know are involved in that, whether it be Carla or whether it be Judy or Corey or whatever, to have input from the Board of Health. And as a Board of Health member, I kind of have multiple hats here. And so, and like I said, some of the Mental Health Advisory Board members have some experience and knowledge that can be beneficial to the update. So does that answer your question?
Yeah, I guess I just, so it sounds like you will have somebody, either Carla or somebody else sitting somewhere. I realize that BHCC, but again, we got to be careful just because it's BHCC and we're talking about social determinants of health and mental health, that the Board of Health has a big role to play in that. And,
Yeah,
I know that's the Board of Health on that group. So I'd assume either Sonia would, or whether you'd want other people. I'm just being a promoter for the Board of Health here.
No, and you're right. And because I'm on both, I think that's another reason why it's easier for me, because like when you're looking through here and they're talking about WIC and family case management and stuff like that on mental health, to me, that's Board of Health should be focusing, but how that ties into the mental health action plan and outreach and things like that. Like I said, because I wear these hats, it's kind of helpful that I can make sure where I focus that's not BHCC's territory, really. This is more, Board of Health territory, but we can work together on moving things forward, kind of thing. So I don't want to step on people's toes.
Well,
and I don't want to overreach,
Yeah, I understand, but I think, territory isn't really meaningful when we're talking about the community health. And, I just say maybe you could use some help too. So, it's a big job. So if you need, I would suggest, although you sit on both committees, that you reach out and find somebody on the Board of Health separate from you just to help you. anyway, that's my soapbox. So, Corey, do you want to make your report?
And I'll try to not be duplicative. So, what Amy sent you was really what was an update for the Mental Health Advisory Board. That was not really exactly what the Mental Health Advisory Board, the cumulative, comprehensive, what the advisory board talked about. It was really an update based on some questions that they had raised. And so I'm going to take you back to what, on our February 22nd meeting, what was really brought up by the Mental Health Advisory Board. And again, the areas that Amy outlined are the same. So stable and safe housing was huge. And I also noticed in the quarterly report from our crisis team, this time for our 553 report, I mean, the last line was, MCA, Center for Human Services, reported the two biggest challenges for crisis included psychiatric inpatient placement because of a decrease in beds because of pandemic, and then an increase in individuals needing hospitalization and the limited availability of resources for basic needs in the community: housing, transportation, utilities. So again, that is what is driving people to get into acute states and needing crisis level service. And we know that's there. So housing figures looms largely everywhere, and we all know that. We also, the Mental Health Advisory Board clearly understands, and that's back to my soapbox that I already got on, which was there's many groups working on this. So how is it that we can be working, how can there be this broad coordination and collaboration so everybody knows what everybody else is doing? And I know United Way put together that Housing Assistance Coalition, which is the townships, the city, Mid-Central Community Action, PATH, Salvation Army, et cetera. And then it's got some other things like Prairie State Legal, some churches, the Immigration Project, et cetera, that are all still part of that. So I think where we left it with Mental Health Advisory Board is we have to know that housing and fear of getting evicted or not being able to pay your rent or not being able to pay your utilities is factoring largely in the mental health of many of our people. And so that has to be a factor in looking at how we are addressing that. But do we have to pay for that? Not necessarily, but do we have to be a player in making sure that those coordinated efforts are that everybody that works with mental health also knows how to get people directed to the right place. So it's all about, how clearly and well is everybody that needs to be apprised aware of what's going on and how they can access support for the people they're seen as clinical clients, for example. And that's some of what Amy provided in her update. She's talking about some upcoming meetings and things like that. So, but again, how do we keep that current in an ever-changing, fluid world right now? So that was kind of where that came from. So are there any questions on housing? And obviously Bloomington Housing Authority is in this mix as well.
Well, and some of the mental health action plan update, there was a section on housing, and that will get updated. So that will actually include probably some of these things these are this, housing coalition and things like that. So I think that's going to be in there. So,
but I think the thing that it speaks to, and everything we talked about, is where is there like a clearinghouse? And I know PATH in some ways is the clearinghouse, and and I know we always said, where's that one door? Where's that one place where people can find what they need? And I still feel like we're struggling with that. And part of it is because the information, it's so fluid right now because of recovery packages and different coalitions that are forming and bringing things to the forefront and stuff. So, but again, how can we decide as a community and a county, where is everything housed? Or, how do we make sure that people know where to get help? And, where is it, not only in terms of where does it live in the digital world, where does it live in terms of an agency entry? how do we make that just crystal clear? Because I still struggle to find information in places where I know it's there somewhere, and I crawl around, web pages until I just want to scream, and to find some simple thing that somehow got embedded 18 screens in. So how do we get that right?
I thought that was what PATH was supposed to be. I mean, I thought that everything, didn't we have this discussion? Was this meeting, or was this a different meeting that I was in about what PATH was supposed to be doing on some of this stuff? And that they were supposed to be, one of the major entry points, especially when it comes to housing and assistance like that.
No, and it is. I mean, but again, that's for that coalition. But then there's other things also on the fringes of that. And how do people know about the fringe things? And and again, if somebody just is coming brand new and doesn't know about the Housing Coalition, how do they stumble across the Housing Coalition? So again, how do we create some, just, and again, PATH does the pathogram. I don't know how many of you are familiar with the pathogram. It's a monthly thing that Violet Pavlik puts out that anybody can get on their mailing list, and it provides updates on new things that are happening. But again, there just needs to be a wonderful digital entry portal too. And then there has to be something for non-digital people, like a call-in center. And again, I know that's PATH, but yet that still isn't working for everybody, clearly.
And Corey, and exactly the 211, which hopefully we'll get back into promoting another day. But United Way reported out in a recent behavioral health overview that their goal is to be the convener and coordinator of resources. And that is different from 211, which is to identify services. But the resources in terms of the various services that people could go to that might not be a service agency, that's what we're talking about here, I believe. And if United Way has started that, I think we need to make sure we take a look at that. And is there some kind of a format that they've laid out? Are they beginning to collect information? And if so, what do they have, and where are they getting it, and who are they sharing it with? Because that continues to be a very serious problem, not just only where you go for the services, but what are all the resources that are in this community, whether they're collaboratives or coalitions, et cetera. We don't have any repository for that.
I have a question and this is a health department, for housing right now, in terms of the anxiety, like people can't go to the shelters or stay as long because of COVID restrictions. Do any of the monies that the health department receive, can that be used to help house those people? I know we have money that would house people who need to be quarantined, but this is sort of like one step before that. But I didn't know if, maybe we can check with Jessica if there's any way, maybe we've been funding people, but if we haven't, could we use those monies to house people who cannot go to the shelters right now?
Well, I think that's where some of the stimulus money is coming in too, is that the city and the town are going to be getting quite a bit of money, like millions and millions of dollars. And I thought that is one of the things that they were focusing on too, when they were doing their block grants, but they actually had extra money there that they had used for housing.
Yeah, but I just thought on an immediate basis, we have these funds in hand now. I don't know where we've been used. Yeah.
Hannah, some of the money in the Cures Act is really restricted. There was, if you read the contract, the restrictions on what you have to, how you can get the money and what you can spend it for is pretty severe. Okay. And it has to be a direct correlation to COVID expenses. So I don't know if you could do that. I don't know if we could use, because we have Cures money left. I just don't know if we could use it for housing, if that would be an allowable expense.
If it's people who can't go to the shelter because of COVID, I don't know, it might be worth looking at if
we can look at it.
Is that
Susan's party's fault, by the way?
It's Susan's party.
I couldn't resist.
I hope that, I know we're watching the clock, and I'd like to have Corey maybe have an opportunity to finish her report.
Yay, Judy. Yes, go.
I was just going to say one more thing about housing too. I also am aware that there is this very larger entity called the Central Illinois Continuum of Care Homeless Services. And that is something PATH is involved with, and it's 11 counties. And so that so again, there's just so much going on. And again, how do we help our providers who are working with people who may come to them for clinical supports, but then they find out that the basis of their, at least part of the basis of their depression, anxiety, whatever it might be, is because of these other housing related conditions or whatever. How do we make sure somebody knows how to grab and help get those resources to people? So that's when we're talking about that, but that repository or that clearinghouse or whatever is huge. Okay, so that was housing kind of at this point. And as you saw, Amy provided us with some good information about some upcoming planning meetings, one as early as the 30th. So, and what we kind of said is, again, we really want to just collect information and develop a plan for expanding and advocating. So again, not expecting us to fund housing necessarily, but what role can we play in terms of just making sure that we are helping with resource expansion and utilization and advertising and advocacy, really. So that was that. And then the next area was basically just the mental health, particularly extreme to the point of suicide or extreme conditions for youth and elderly. But that was, I mean, we're worried about the entire population, but we particularly focused, the Mental Health Advisory Board members particularly focused on youth and seniors. And, we also know that there's lots going on with the senior situation. For example, Carla, I don't know how much you can tell us about the Center for Senior Advocacy that was funded by a federal grant that's ISU nursing department working with community. It's supposed to open up the community connections to the ISU nursing department and how all of that can better serve seniors. Do you know anything about that?
Mm-mm.
Okay. That got brought up at the behavioral health priority action team meeting on Tuesday. So that's something we need to find out about because, so again, it's what we came up with again, the Mental Health Advisory Board came back to the same conclusion as we know there's lots of stuff out there. How are we sharing that information? How are we coordinating that information? How are we clear what deliverables is everybody supposed to be doing? How can we make sure that everybody's got their niche, well understood, and how we're supporting each other and working fluidly back and forth between all these initiatives? Because we know we've got, the Area Center on Aging, or Area Agency on Aging. We've got the ARC. We've got Faith in Action. We've got senior housing. We've got, all of that kind of stuff. And we also know that, we've got Project Oz out there doing the Ending the Silence for Youth, but they are frequently asked to go into senior living facilities to do that. And I don't know that they have the money or to do that. I know they do it, but I don't know to what degree. So again, how are we using existing resources to support the mental health of seniors? And then the same thing with youth. We're very concerned. We all have heard all the stories, both nationally and locally, about too many youth have literally disappeared from the school community and school supports during the pandemic and during remote learning. They're ghosts. And so school resource officers in our area have been asked to do lots of outreach to try to find these kids. So anyway, we know we've got kids in dire conditions, and we know that coming back for some of these kids is going to be really hard for kids that have social anxiety and they've not had to interact. And so the schools are going to have to do so much to gear up for just re-engaging schools and families that have, drifted away. So those were the two areas that they really, really want to talk about. And again, we've talked before, we have lots of youth services kind of things going on. For example, we've got we've talked about the District 87 grant. We've got the new comprehensive advisement team that was the pilot we started a long time ago that did get funded. We got a new grant for that, and that's to work with kids that have some juvenile involvement and obviously mental health needs. We've got the embedded schools. We've got community schools. We've got John M. Scott doing something with youth. We've got United Way doing something with youth. They've actually started a coalition for childcare and youth programming. So again, how are we putting all that together and being real clear about who's doing what and how are we maximizing that? So we also asked, the Mental Health Advisory Board said, just how can we gather information, get some data, figure out what's going on. Okay, so that was point 2. Any questions on that before I go to the third one? Okay, third area was re-entry into the community from the justice system. And we have heard about.
I think Susan had a question. No, she didn't. Okay.
No, you sure? Okay. So we've heard about that for a long time. And Christine Strauss, who's on the Mental Health Advisory Board, she's a clinical psychologist. And, she is particularly concerned about the lack of access and funding to pay for psychological and psychiatric services for these people as they come out of DOC or whatever. And again, their needs are so exacerbated by not being able to secure employment, stable housing, case management, transportation. So again, we know there's lots going on, in that area. We've got the Criminal Justice Coordinating Council, the Criminal Reform Bill is out there. We've got, but we also know that Illinois Department of Juvenile Justice and Illinois Department of Corrections has no money to give to people as they exit their systems, no money. And so what do we as a community do about that? And we've got 3 people on the Mental Health Advisory Board that have a passion for this, and that is Christine Strauss, and I should also say passion and expertise, Dan Deneen, who wrote up a really nice little outline of things that might be done, and then Martha Dittmer as a parole officer, that could all speak to, and Christine has offered to, both Christine and Dan have offered to put something together, a draft for us to look at. So that's something we probably need to talk about. But so kind of that was that area, but we know those people need services. And we also know, does triage play a role here? Does Fuse play a role here? How, again, are county programs, is there any role here? Case management, all of that. So we know and I would also say case management kind of figures across all 3 of these areas. Like, how do you have somebody that people can go to that really is their, that can get them started into whatever they might need. So then again, globally across all 3 of these areas, we talked about looking at models of what other communities are doing, and that's something that, when with the Mental Health Action Plan, we did invite people in to talk about models. And, I don't know whether, Susan, you're planning on doing some of that again. Are we going to look at any community models that in any area? And again, Tricia Malott has also indicated that she and her staff may be able to assist with some of this. Because they, when they're not fully, when they don't have full caseload, so to speak, she's got people that are being paid that could put their expertise towards doing some of that kind of research. So we talked about that. Then obviously the whole other area is substance use, Ross, we've got that whole recovery-oriented system of care that Chestnut is working on. And again, how are we bringing that to bear on all of these things too, because there's certainly overlap here with some mental health and substance use issues. And certainly as a 553 board, we are supposed to be also paying attention to substance use. And we have heard that methamphetamines are big into the community, and I shouldn't say big into the community, but that's what we're hearing about. And they're mixing those with opioids, and that is a very dangerous combination. And so there's real concern about that. And people at PATH have talked about, you throw all of this mix that we just talked about, and then you put guns into the situation too. And there's also potential for gun violence. So, I could go bigger and bigger. I'm going to stop. But anyway, those three areas and looking at how can mental health advisory board, they're very willing to be helpful in doing research and looking at models and bringing forth information, et cetera.
Yeah, I'm going to jump in here to address actually some of those things. The mental health action plan update, and I hope you guys have, there's some guys talking over here. I hope you don't hear them. The mental health action plan update is going to take, like I said earlier, has a lot of what's already been written in these notes and what you just said. One of the things that I am using is a sequential intercept model, because that's, pretty standard model. And then there's a whole lot of best practices that go with each one of those intercepts. And, we want to really focus on intercept 0 before they ever get in the justice system, but then at the end, the intercept, I think 5, 1, 0, 1, 2, 3, 5, that's the reentry. And there's all those points in between, which include drug court, recovery court, and in through that whole justice system. So I am using the sequential intercept model in the mental health action plan update. And so and SAMHSA has been putting out a ton of best practices for a lot of different topics, not just that, but for substance abuse and things. So I am going to incorporate a lot of that into the mental health action plan update as to these are best practices. So instead of, how when we had the needs assessment and then the best practices committee and we had those people come in, I think that we can use some of the documentation that's already existing, and that if we do need to contact someone on a best practice that actually has a model that we like to see, because with our DDJ involvement and stuff like that, it's not always just people that are involved in the justice system, because they're also doing the overarching, behavioral health in the community where when you're even talking about housing and that part of it, the housing insecurity, and the homeless population. So we have a lot of communities that we have relationships with that we can always utilize in some of their best practices that we've learned about too. So that's all going to be incorporated into the mental health action plan. And that's where people like Dr. Strauss and the other person, I can't remember who it is.
Dan
Yeah.
Deneen.
Yeah. And those are the people that have more expertise in there. We can, when I try to get down to some granular data and granular outcomes and things like that, that's when I will consult with them and ask them for some more details and that kind of thing. So I think that a lot of the things that the Mental Health Advisory Board is looking at is going to be incorporated into some of that, into the Mental Health Action Plan update. Like I said, the Mental Health Action Plan update got a lot larger as I kept going through it and going, oh, there's this, and then there's this, and then there's this, and then there's this, and it's gotten quite large. So, and I hope to have it done sooner rather than later, because I think that we need to have a lot of the stuff addressed sooner rather than later, and have a plan going forward for the community, not just, 1 or 2 areas. I think that we have to have a well-written, thought out, overarching plan for the whole county.
And do you when you think where you are and when you hope to be done?
I've had other people ask me that question, and I don't really want to say anything because I don't want to put any expectations out. Because, and you were around when we did the first one, Hannah and Corey and Judy, in our small groups, and you start going down those rabbit holes, and then you find a whole lot more that you didn't. And so that's why I don't want to say, oh, I'll be done in a month, kind of thing, because, you might find something that really needs a lot more research, or maybe, somebody needs to really go somewhere and see something. Like when I've gone to Johnson County, Kansas and talked to them, and just trying to connect with people. People are so busy now with things. It's very hard to connect with people, even though they want to connect. And so that's why I really don't want to put any timelines on anything yet.
One thing I would say, and it just seems to kind of come up common sense wise, is that for youth returning to school in the fall, it would be so good if we if we could, have some sort of a really coordinated thing, that schools or any entity working with youth, like Boys and Girls Club or whoever, that, we've really put something together that would guide what we're doing as a community, as a county. Because I just see that that's going to be such a huge need as families and kids try to come back. And I mean, I know schools are starting to come back now, and I know District 87 in particular has talked about they're wanting to do a lot of summer programming, which has nothing to do with that mental health grant. It's just they realize there's going to have to try to find and help get kids shored back up. So, but I think the youth thing is going to be huge, to get schools ready to have some sort of more normalized opening in the fall.
And Chairman McIntyre is really going to be focusing on youth. He's on vacation also, from what I understand. And he is going to be working on that because that's his forte. I mean, when you figure he's coach and principal and teacher and all that stuff, he is very, very, very focused on youth and moving youth forward. And so he's going to be convening some groups on that part, I believe. And I might be sitting in on him, I'm not sure, but hopefully when we get back from vacation and stuff like that, we'll have a better direction as to how he's going to go about doing that and what my role in that is going to be too. But yeah, and I've thought about too, and even on this update, it's like, okay, do I do a section and then put it out? Do I do a section and put it out without having the overarching thing? And it's because, like I said, there's some that like you said, youth, you really want to have something now, but if you don't have all the other parts to it, it's kind of hard sometimes. So I will get with him on that so that maybe I can get back with you. We can have a conversation as to how that's gonna, all fall out, especially if we're gonna talk with Mark about
Exactly.
the embedded
Just where I was
schools and
going.
stuff. So, and I know he's going to be getting with Mark on this whole thing too. So I guess I don't want 10 people contacting the same person on something,
All right, great. So Corey, thank you very much for that very informative and thought-provoking report. So I think we're past our scheduled time. Our next meeting is April 30th. And I would like to think that at that meeting, we'll probably bring back some information from ROE. And as far as that, maybe we can continue and bring up, kind of refine our discussion on the process. I mean, as I sit here, I'm thinking, we keep trying to reinvent the wheel. Maybe what we should look at is trying to stay true to what we did last year with some fine tuning. For example, requesting reports on financial data, et cetera, from everybody as a part of the application process. So we're not coming in at the back end. And anything else that people can think of. So maybe next meeting, try to kind of come to some conclusions on how we want to put the RFP out for this year's funding or 2022 funding. So I don't know if anybody else has anything else. Yes, Corey.
And I should have done this under a different section. I apologize, but I think I shared with some of you that I had a conversation because of adult psychiatry. We knew that we had not given them as much funding as they had requested, and they had told us that meant that there would be some. They would not be able to serve the same number of people. So I have continued to be worried about what does that mean? Are there people out there that are in dire need of adult psychiatric supports and not getting them? So I had asked Amy to ask some questions, and I think she sent you all the information that Sue Pirtle at Center for Human Services was kind enough to respond to. And the bottom line was, I'm going straight to there were like 18 people. You did not get that, Susan? Okay, so basically I just had asked Amy to reach out to Center for Human Services and say, okay, we know that you told us that you were going to have to not be able to serve as many people as you've done in the past. I said, what are the numbers? How many were not able to be served, and what has happened to them? And is there follow-up on those people? And the short the short version of the response was they have referred a lot of them to primary care providers, and in some cases that seems to be going quite well. But there are 18 people right now that they have not been able to kind of assign to someone else, and they're still working on trying to figure out how to assign those. So I had reached out to Tricia way back when we were debating how much we were not going to fund for adult psychiatric, in the fall, and asked Tricia if there was any role that triage could play with these people. Because again, I just worry about, are there people out there just not being serviced that have acute needs? And Tricia had said, yes, there might be a role. Well, then time has elapsed, and I don't know that anybody tied that together. So long story short, I reached out to Tricia again the other day and said, okay, we now know that there's 18 people that aren't connected. Could you play a role in that? And she said again, yes, I think that we might be able to play a role, including maybe even doing some follow-up kinds of activities, whatever, as well as being, if they needed acute support, that's what triage is there for anybody in the county anyway. But so what Tricia, in our conversation, what Tricia asked was that this body kind of say to her, yes, we want you to move forward with that. We would like you to have a conversation with Center for Human Services just to explore, is there any kind of a coordinated effort that could be made on behalf of some of these adult psychiatric clients, and they work out what that might look like. I'm not trying to dictate what that should be, but I'm just asking that if there could be some sort of supports that could come from triage for these people that are not being served, let's ask them to at least have a conversation. And Tricia just kind of wanted this group to give her that direction.
Yeah, Judy.
Yeah, I think that would be a good idea, because Tricia's close to a program that we think might be able to be of some help. And Corey, in the discussion that you had with Tricia of these 18 clients, was there discussion of medications? Because I'm presuming if they are released from CHS, they're probably no longer eligible for that free medication. And that becomes, I would suspect, a big part of their service. And so I think I would like to ask that when Tricia visits with CHS, that they discuss the medication and how, if she is able to help with some triage and support services, how do we get meds to these folks?
And, I just would like to say I don't know that, certainly I'm sure to a person on this committee, any kind of sharing and working together across organizations is something we support wholeheartedly. I don't know that we need to take action on something like that. I think that's something that I'm sure that Tricia appreciates and CHS also appreciates, and I would encourage them to work together to that end, certainly. One of the comments that you made, Corey, that brings me back to our reporting discussion. I don't know how we do it, but I think one of the things that brought to mind is maybe it would be nice to see what on a report, if we see there's a reduction on a quarter in terms of the people served, and that goes to outcomes and objectives as well, with the numbers versus percentages of those numbers who are no longer being served. Did they graduate? They're better and they didn't need the service. They were referred to another provider. Just the reasons that maybe for that allows us to see who those 18 people are in a better sense. Because I was interested when I saw the email when Sue was saying some people are going to their primary care, which is something that's been talked about for a number of years, of getting primary care physicians more comfortable with prescribing some medications. So that's good to see happening.
And that brought up for me the whole idea about, is there a role here somewhere where we could even provide some sort of consultation? We could identify who might be the right person to provide some sort of consultation for primary care providers, like just so that they would know if they have agreed to take on some of these clients and maybe something comes up that they didn't anticipate. Who, do they know that they have the right to get immediate consult from someone if there's confidentiality and all of that. But I mean, again, I would love to have a discussion about that too. I mean, so again, it's, to me, that's building a system. If we're saying we can't do X, but somebody else can, then what have we done to that, the people that have stepped up to do it? Are we giving them the supports they need? And to me, that's how you build a system and how you also sustain it when you bring in new players. Have you given the new players the support they need? And I'm also wondering where, Chestnut's federally qualified healthcare center fits into this as well. And I know that they do. I know some of them, I'm sure, were referred there. I have no doubt. But again, you're right, Hannah, we don't have that quantified in any.
I think we're drifting into an area which we, probably should say for another meeting with, so I don't know, I think, Susan, I don't know if you wanted to comment or whether you were coming to that same conclusion that, I think addressing specific topics of these areas really wasn't on our agenda. So I would say let's good to know that the conversation is taking place right now. So anybody else, and I think that maybe we've reached the point of adjournment. Anybody have anything more to add or want to move to adjourn?
I moved to adjourn because I'm ready for the beach.
You thinker.
Baby.
A second for that? Yeah, I guess we don't necessarily, but by, acclamation, we all agree to adjourn and enjoy your day at the beach, Susan. Don't get sunburned.
I'm so jealous I could start screaming.
Oh, golf was awesome. The 4 days in Orlando golfing was awesome.
That's great.
And I'll be doing some more golfing in the next week or two.